should we consider, or is it reasonable to consider that the prescription for psychotropics is a kind of hidden anti-psychiatry?
Yeah, so I guess it's good that you asked this question, because I do hear this kind of criticism sometimes, that there's something anti-psychiatry about stopping medications. I'm a little bit saddened to hear that criticism, because I think our job as psychiatrists should be to provide the best care to our patients. And when that involves starting medications, that's an important skill set to have. But I think equally important is knowing when to stop medications and knowing how to stop medications. So I think that it's a part of good psychiatry, of high quality psychiatry, to be able to be a careful deprescriber. I think that saying that some people have more harm than benefit from medications at certain time points is not an anti-psychiatry position. I think it's an evidence-based psychiatry position. There's a quote from Philip Penel, who I guess is French, said, "It is an art of no little importance to administer medicines properly, but it is an art of much greater and more difficult acquisition to know when to suspend or altogether omit them." And so I think it is part of a sophisticated and psychiatrist's toolbox to know when to start, when to stop, and how to do that carefully. And I think the other aspect is patients have expressed a lot of unhappiness about not being able to be helped to stop medication when they want to. And because of that, many patients have left psychiatrists' offices and other doctors' offices and ended up in online peer support communities, which may play an important role, but it really shouldn't be the case that we know how to start medications and not to stop medications. I think of this a little bit like selling cars with brakes. We really should be providing cars that are useful to people that are also able to be stopped safely. So I reject the view that deprescribing is an anti-psychiatry position. I think it's a part of good, personalized, modern psychiatry.